Okay, so last time we started our discussion about histamine. So discuss na kanino how is histamine formed in the body, how is it released, saan siya galing, and what are the effects of histamine in the body also. Now, upload na ba? Wala pa. Wala pa na-upload. Let me just upload later. Kindly remind me. Nakalimot siguro kung upload ani. Wait lang. So ba ito nag-end last time? I think we ended with the different, this one. Tama ba? First generation antihistamines up to the cyproheptadine. What you need to take note about the first generation is sila yung mga antihistamine natin na there is always marked sedation. Since they are lipophilic, they can cross the blood-brain barrier and they can inhibit the effect of histamine in the brain. Now, histamine is always involved in our sleep, so our sleep pattern. Thus, if we inhibit that, na siya nga naay sedation or naay drowsiness. Now, for the second generation class, though some of them can be sedating, but the sedating na action is lesser compared to the first generation. And that is attributed to their character na hindi sila masyadong lipophilic. They cannot 100% cross the blood-brain barrier. Hindi sila completely ma-distribute in the central nervous system. So again, lesser ang sedating effect nila. But nevertheless, parehas silang antihistamine. They will inhibit the histamine 1 receptor. Let me give emphasis to that because diba, we have 4 types of histamine receptors, and if we are going to use antihistamine for allergy, their action is specific to H1 receptor. They will bind to that receptor, inhibit the effect of histamine. Thus, kung unsa man tong mga effect na ni histamine like the inflammation, the vasodilation, matambalan to sila. So there will be effects especially on the smooth muscles and the CNS. But just like the first generation antihistamine, this is still again for IgE immediate or IgE mediated allergies like hay fever and urticaria. Now the toxicity, again, there is still sedation. There is still sedation class, but it's lesser compared to the first generation antihistamine. And our problem now with the second gen is arrhythmia, especially in overdose. So please be mindful of the dose na pwede lang for our second gen. For example, cetirizine. Cetirizine is actually under the second generation, though it can still cause drowsiness, no? Pero dili parehas sa uban. Ang cetirizine class, the maximum dose sa isa ka adlaw is 10 milligrams. And if you look at the available dose in the market for our cetirizine, it's 10 milligrams gihapon. So definitely it should be given once a day only. Because if we will have overdose of that, ayun na, pwede na siya mag-cause og arrhythmia. So, makadaot siya sa heart class, especially sa heart rate. Okay? Any questions so far? Wait. Unsa ang hay fever? Hay fever is allergic rhinitis. Naman daghan diri sa ato na allergic rhinitis. Labi na pagka ng most of the time the allergic rhinitis is triggered early in the morning. Anang pagmata bitaw nimo. Sige na din pagpangatching, that is hay fever. So a person with hay fever or allergic rhinitis is recommended to change the bed sheet, the kanang pillowcases once a week. Once a week, every week kailangan magpalit ta og mga beddings nato kasi it may trigger our hay fever. Yeah, another term sa rhinitis. Yeah, another term. Allergic rhinitis is the medical term and the layman's term is hay fever. Pero the medical term is more common compared to the layman's term. Kapoy na kayo sigla ba? Wala tayong mabuhat pag natay allergic rhinitis. Magsige gyud tag magsige tag ilis og beddings tapos dili ta pwede manilhig kasi pag manilhig manggug ka class ang mga dust particles bitaw magsabog musaka noon siya and mas malanghap hinuon nimo siya pag manilhig ka and according sa studies dugay murag at least a whole day or how many days before mag-settle down ng abong pag manilhig ka. So maka-trigger na siya sa ato ang allergic rhinitis. So dapat pag ikaw tong naay allergic rhinitis, ang imuhang gamiton lang pag manglimpyo ka is sa ganina kanang vacuum imuhang gamiton. Bawal manilhig, vacuum na this. Yes, rich kid. Pag allergic rhinitis, pag naka-allergic rhinitis, dapat rich kid ka. Nakay vacuum kay di ka pwede manilhig. So, kana lang ang lisod pag nakay hay fever. Sabi na pag taga-solidad ka. Pag taga-solidad ka niya, abog kayo ang kanang sa pasulod yun sa solidad mo, nagyud na siyang problema, abog kaayo. ang allergy lang ang pang-rich. Okay, pare-parehas taan ni class. Basta mag hay fever na kumaluya gid ba ako niya. Kanang maghigda, lamig kayo ihigda tibuok adlaw. But I don't really drink antihistamine. I don't take antihistamine whether it is cetirizine or loratadine. Ginapasagdan ko lang na siyang ako ang allergy hangtod mahuman siya. And during the board exam, I have my allergic rhinitis attack during the boards. As in, during the boards, yun mo ito nga, nag-ampo na lang yun ko ato makapasa ko sa board exam kay murag. Lain na dyan kayo kung paminaw. I have nananghid yun ko sa proctor na I need my handkerchief. You're not allowed to have your handkerchief during the boards. Pero nananghid ko sa proctor kay murag nagatulog yun ang ako ang ilong during the board exam. As in, grabe, basa kayo damak. Basa kayo akong panyo pag human sa boards. Kaya na-trigger yun siya. Siguro because of number 1, na stress ko. Number 2, kay naka-aircon magud that time mo. Nadili po pwede mag-aircon kay mag-allergic rhinitis yun ko. May nalawa kay allergy required my I have tried having that test good kanang skin test for allergy kanang daghan kog kayo dire sa kamot linya-linya just to determine my the allergens nako jud siya mostly inhalational jud ang ako ang allergens. So allergic rhinitis gyud ang ako. Di pareha sa uban nga manok, itlog wala ko yung mga ingan ng allergy pero inhalational tanan. So pag magklase tayo pud mo pagpahumot sa akong atubangan class kay wa na gyud di na muundang akong ilong Yeah, sa kanang aso dili jud maglagot jud ko basta na ay magsunog. Nanagay magsunog na as in jud bahok kayo ang aso dili pud ko manirado ko sa amo ang balay kay wa na gyud akong ilong di na ko ginhawa na pagkahuman. Okay, so what are the examples of our second generation antihistamine? We have here the fexofenadine. If you are looking for an antihistamine na cannot cause drowsiness, fexofenadine yun na siya class. Kanang dili yung ka makatulog but it can cure your allergy. Again, it's called fexofenadine. We have a lot of fexofenadine in the market. Ang disadvantage lang of using the fexofenadine is mahal. This one is very expensive compared to other antihistamine. Wala na ko kabalo kung tagpila sila karon, but as far as I can remember, murag nasa 80 pesos ang isa ka tablet ani compared sa uban no nga barato lang barato lang, pero og dili gyud ka gusto makatulog na mag-inom kag antihistamine, fexofenadine jud na siya. Now the loratadine is also another one. Dito katulog maglurat imong mata ani. It cannot also cause drowsiness. So we have loratadine in the market. Also example, claritin. This is also your option if you are going to do something and you have your allergy attack. Now cetirizine, though this is a second generation antihistamine, pero naa siya slight sedation na effect. Slight pa lang na iyang sedation ha, pero naiuban nga kanang moinom og cetirizine nga lakas tama juga yung cetirizine sa ilaha nga makatulog yun sila. Pero less lang ang sedation na compared if you're going to take diphenhydramine or especially the hydroxyzine, the Iterax. Grabe yun na siya maka-sedate. So we have here drugs, original drugs, and their metabolites. So like hydroxyzine diba is the Iterax, and inside the body it will be converted into cetirizine. That is the reason why it is very sedating, because hydroxyzine itself is a sedative, and then inside the body it will release the metabolite cetirizine, which is another sedative. So medyo dugay-dugay gyud ang imuhang tulog ani. And then we have the terfenadine. Terfenadine is not available in the market anymore because it can cause arrhythmia, pero its metabolite fexofenadine, which is not a sedative, is still available in the market. And then we have loratadine and its metabolite desloratadine are both available silang duha in the market, and they cannot really cause sedation. So mga ano lang ni sila, mga drugs na we also have available drugs in the market na active metabolite nila. So how often do you, kato may mga allergy, how often do you take antihistamine? Adlaw? Makaugar ba ng antihistamine? Hayo po din yun.
Ano lang ma'am, pag di na makaya.
Pag dili na makaya, sige. Ano na lang, just avoid those things na grabe makakos imuhang allergy. Kaya ang uban man good, dili na ito mabalaan, basig mauwi siya into anaphylactic shock. So again, please avoid the allergens. Okay? Next, H2 receptor antagonist. We are done with the antihistamine for the H1 receptors. The H2 now is, they are drugs that reduce gastric acid secretion. Thus, these are used for ulcer or for hyperacidity. We also use this for GERD or the gastroesophageal reflux disease, or for Zollinger-Ellison syndrome. I think that is a condition wherein you have your tumor in the gastrointestinal tract that will trigger the release of a lot of gastric acid. So kanya ginagamit sila. Wait lang. And then, unsa ni sila ng mga drugs? We have here, the first one is the cimetidine, and then we have the ranitidine, famotidine, and I forgot the other one. Let me check. Let me check first. Yeah, tama. We have also the nizatidine. So you will, recognize them sa ilahang name. They all end with tidine. I forgot the brand names. I'm not really familiar with the brand names. So it will be your task now to look at the most commonly used brands in the market for the following antihistamine or H2 receptor blockers, or we call them H2 receptor antagonists. Saan tinuod na pagdili ka magkaon, maglala imuhang allergy? What do you mean? Isa sila mag-desensitize sila, sige noon sila kaon sa food na sila allergy until such time na magkaroon ng tolerance. Ana, I actually don't know about that. Mas lala ilahang atake. I'm not really sure, but since your body has developed antibodies for that, mag-react man yun ang imuhang lawas. Mag-react dyan ang imuhang lawas. Pero ang ako lang, in my case, sa ako my suggestion is to avoid those things. Kaya dili man po nato gusto nga basin, wa man ta kabalo basin mauwi siya into what do you call that? Anaphylactic shock. Diba? Mawala pa ang allergy, ma'am. When I had my skin test na sila ginahimo na procedure, I forgot the name, na para mawala imuhang allergy. Murag ano ba tong tawag ato? Murag mag-desensitize ka sa imuhang lawas. I cannot really remember the name of the procedure, pero yes, na ginahimo ang mga allergologists for that, para mawala imong allergy. Hago kayo. Hago man dyan ang naay allergy. Na kay dili pwede kaunon. Or dili ka dapat ma-expose for that. Pero kanya-kanya ra magud tag allergy good. Dili lang ta pareho. Yeah, so nga ni kaon man siya balik, nakabalo man siya nga naa siya allergy for that. Kung nag-stop siya kaon, nag-stop na jud ka og kaon. Kay mag-expect gug ka nga pagkaon nimo ulit ana, mo react yun gihapon imuhang lawas. So kana ang reaction sa iya, hapil na ang hika. So ano mo kaon makaulit kung kabalo ka nga na allergic day ka ana. Ayaw ka na balik kung kabalo ka nga allergic na ka for that, because we don't know if it can trigger a kanang stronger nga effect sa body, not just with your skin but including your bronchioles. So ayaw ipilit. Ayaw ipilit kung ang ingon sa you have to listen to your body class. Ingon sa imong lawas nga dili ayaw. Kung dili na siya magkaon og isda og kanon, at least napay nabilin kanon. Ang lisod kung allergic ka sa kanon. Kung ingana gud ang case daghan siya allergy, you have to seek help sa allergologist, kasi again they have their procedure na ginahimo to desensitize your body from the allergens. Kung daghan na gyud kay hawa na kay makaon, grabe na gyud. Okay, next, H3 receptor antagonist. Magsalig sa tambal. Mukhaon og shrimp na bitaw si Tirisin, ana. Sa mukha. If okay lang sa imuha, then go. Mag-inom og tambal. Ayun lang ninyo na adlaw-adlaw ha. Kasi remember, ang atong mga first generation are also anticholinergic or antimuscarinic. Mauga ka anak class. And then our second generations can cause arrhythmia in overdose. So ayaw pud ninyo pasubra eh. Kung gusto kong kakanunon, dili na gid mapugngan ang kaibog. Then go. Panagang mo sa inyong antihistamine, because again, we don't want na mauwi siya into anaphylactic shock. Okay, next, the H3 receptor antagonist. The histamine 3 receptors can be found also in the brain, and it has an activity regarding ang yung activity involves our sleep. So, sleeping patterns nato. And it can also be found sa other parts sa atong body. So, na siya effect into again the sleeping pattern or even the obesity and cognitive and psychiatric disorders. Actually, we have one drug, the tripolisant. That's the name of the drug. It's an antagonist sa H3 receptor. And animal studies showed that it can reduce the sleeping cycle sa mga ilaga, and sa humans also, the human studies also showed na it can reduce the sleeping cycles of people with narcolepsy. Di ba ang narcolepsy kato ng mukalit lang bitaw sila katulog class? They have problems with their brain and yung mukalit lang sila og katulog. Nya kung i-antagonize man gud nato ang histamine na naa sa brain, maapektuhan ang sleeping pattern. So, appeal na ni diri tripolisant, the H3 antagonist. Yeah, sleeping beauty mo na siya, narcolepsy. Now, the H4 receptor antagonist has actually potential as anti-inflammatory agents, especially for asthma and for those immune cells involved in asthma also and other types of inflammation. But we don't have drugs nowadays na kanang H4 receptor good. They are all under study, under investigation pa. Ang nagyud sa ato ang market karon na widely used are the H1 antagonist, ang atong antihistamine for allergy, and the H2 antagonist na para sa gastric juice. Pero if I'm not mistaken, the ranitidine has been studied and most likely murag hapit na ma-withdraw in the market because it can be a carcinogenic drug. Murag carcinogenic, murag karon pa nila na nakita na again it can be carcinogenic. So if you look at the prescriptions of the doctors for the patients with excessive acid or naay GERD, most of the time either they give antacids na lang or the PPI, the proton pump inhibitors, kanang nag-end good sa prazole, omeprazole, pantoprazole, and so on. So mo na ilahang ginagamit so far. Again, because of the studies about ranitidine that can cause cancer. But nevertheless, again, they are called H2 receptor antagonist. Questions about our antihistamines so far? Once a day, mostly ato ang mga antihistamine ha, except for there are first generation antihistamine like diphenhydramine that can be given up to twice a day. And most of the time, class, as pharmacists, you really have to inform the patient that the drug may be sedating and that it is best given at bedtime para wala sila himuon na mga physical activities and then dili magkaroon og accident due to sedation. Okay? Wala pangutana about our antihistamines? How about the bonamine? The bonamine is given at least an hour before ka mag-travel, because that is an anti-motion sickness agent sa mga dagaton. That is still antihistamine class. You can also be sedated. So, pwede ka nga you are asleep all throughout the travel, the trip class. Mo na siya ang gamit ni meclizine. So, mga 1 hour before ka mag-travel. Remember that the drug is to be disintegrated. It should be dissolved and absorbed pa. So, ayun ninyo siya inom ka ng paglarga sa bus, anhapon mo nag-inom, naglipong-lipong na wala pa nag-take effect ang drug. Pero di nila alam. So, as pharmacist ha, pag may mo palit ganig bonamine, you also have to tell them it should be 1 hour before the travel, so that during na mo larga na ang bus, mo take nag effect ang drug, dili kay naanak ka sa may sarangani dapit mo padong kag Davao, naanak ka sarangani dapit anha pa nag-take effect mong drug, naglipong-lipong nakagsugod, nagsuka-suka nakagsugod. Okay? And that is chewable. Most of our meclizines, dili lang man na bonamine good ang iyahang brand sa market, are chewable. So you really have to chew And dili di siya mag-disintegrate kay chewable drugs dahil sila. Ang problema pud sa uban, masigig reklamuha man effect ang bunamin sa aqua. Oy, paano siya dili mo effect nga imong nang giinom og tablet na kanang oral tablet na to nga chewable man ang meclizine. Kailangan na nimo usapon. So naay mga cases kay ana gitulon diretso. Paano siya mag-take og proper niya nga effect kung imuha siyang giinom pareha sa paracetamol nga gitulon nimo with the help of water. Unsa magpalit og meclizine kanang before mo saka sa bus. Mao gid na siya ang tendency nato permi. Before mo saka sa bus mo palit og meclizine unya mo inom nya after 20 minutes after 10 minutes nilarga na ang bus tingala pa ka kung nalipong ka way epekto wala na ni effect ang meclizine sa imuha. So again, be careful with the proper usage of our drug. Yeah, pwede mag-drink of water after ka mag-chew sa imuhang chewable na tablet. Especially na medyo tamis-tamis na sila noon ay nagid na siya tamis-tamis na component kay syempre gitsugod nato siya ni mabilin man gud siya sa imuhang ba ang lasa. So pwede ka mo inom og tubig. Parehas pud ng Kremel S, nag-hyperacidity sila. Inom sila Kremel S, wala ni epekto. Ano na mo epekto nga chewable man ang Kremel S niya imuhang gitulon. So, remember class sa inyong DDS or sa inyong Manuf, I cannot remember on some subject na gina-discuss, the chewable tablets don't have disintegrating agents. Diba? Itong mga tablets na ay mga excipients and itong mga tablets, mga film-coated na mga tablets for oral consumption na sila disintegrating agent to help in the disintegration of the tablet para mag-break down siya. Now, the chewable tablets don't have disintegrating agent na excipient. So, mo nang ikaw ang mag-break down sa tablet, ikaw ang mag-chew. Mo na kalahian nila. Unya kay mo manggitulon diritso. Saan pag-breakdown? Dugay kay ito mag-breakdown sa sulod. Para dili daw nila malasahan. Yun pagtambal, ayun na lang pag-inom og tambal kung dili man day ka mutsuana. Okay? So again, please educate them about the chewable tablets also. Our problem if dili ni mo na siya i-chew is since wala siya disintegrating agent, magka-problem ta with the pharmacokinetic na activity na ay possibility na dili siya mag-breakdown. So ma-push lang siya since our stomach, our gastrointestinal tract is in constant motion, ma-push lang siya, hindi siya mag-breakdown sa imuhang stomach, ma-push lang siya sa small intestines or sa large intestines nato, and then dili siya mag-breakdown. So kaon nimo siya as tablet, ilibang nimo siya as tablet gihapon. Nay possibility nga. So definitely kung wala na siya nag-breakdown, there will be no release of the active ingredient and magka-problema ta with the effect of the drug also. Now in some cases we don't know, wala man ta kita kung naunsa siya sa ato ang stomach, right? Kung in some cases nga mag-breakdown siya pero dugay kayo na mag-breakdown, asa na siya dapit sa ato ang tiyan nag-breakdown. Kay tungod again wala siya disintegrating agent. So mo na ato ang problema kung wala gitsu ang tambal. Na possibility na wala siya effect kay wala siya nag-breakdown. I hope that is clear. Pag moingon gani ang tablet, pag nakabutang gani chewable, itchew anong gahi man tagulo. Anong gahi man tagulo anang itchew gani ang mga chewable na tablet ni maglibog din tag nganong wala siya nag take og effect. Natural wala ta nagsunod sa dapat na instruction. Or parehas anang effervescent tablet. Pag effervescent tablet niya mong gitulon diretso magbula-bula na dito sa sulod sa imuhang esophagus and that will be painful for you. Para sa akong uncle gitulon daw niya ang fluimucil. Gihimo niya murag, di ba the fluimucil is a big tablet And you need to dissolve that in a glass of water. Ang iyang gihimo, yung gitulon diretso. Sakit na kayo diri handughan murag daw ginalata iyang dughan. Syempre nagbula-bula dito ang effervescent preparation sa mukha. So again, please as pharmacists, you have to educate the patients for proper administration of the drug also. Yeah, the suspension also. Pag moingon gani sa label na shake well before use, dili ta magahig ulo, i-shake gani ang tambal. Kasi akong labi na pag suspension, pwede manggod na ang suspension, the particles will settle at the bottom. And kung imuhan na siyang dili i-shake, ang ma-underdose ka class kasi some of the particles are not kanang uniformly distributed sa imuhang liquid. So, ma-underdose ka kung dili mo na siya i-shake. Ikaw na lang dili pod pwede nga magambak-ambak ang patient kay nabilin man ang particles sa bote. So, wala gihapon. So, or kanang mga nebules nga ginainom or baliktad. For example, the Bacillus clausi, the Ursiflora. I hope you're familiar with Ursiflora. Naka-nebule man gud na siya. So naiuban tungod kay wala nag-ingon ang pharmacist kung unsaon siya, gibutang nila sa nebulizer ang Ursiflora. Kay naanad lagi nga pareha sila nawong sa mga kanang salbutamol bitaw nga naka-nebule, so ibutang i-inhale. Where in fact, the Ursiflora, though naka-nebule na siya, contains the bacteria, Bacillus clausi. Ginagamit nato na siya for like diarrhea. Parehas lang gud siya klase sa Yakult, 'di ba? Na probiotic. So napunta yung nga drug sa market. Yung problema kay ang uban gi-inhalational naman nila, gibutang nila sa nebulizer. So again, our work is very important para dili lang magpatakag inom tambal ato ang mga patient. Okay? Now, after histamine, we also have serotonin. Sa feeling i-inhale ang bacteria. Wala pa po ko nakatry kung paano to nandiyan nahitabo ato pag i-inhale na nimo ang bacteria. We have the serotonin class. Usahay makita ninyo ni siya. Wala magud na nila ginabuo usahay og sulat. Pag makakita gani mo ani sa mga questions, 5-HT automatic, that is the serotonin because the chemical name of serotonin is 5-hydroxytryptamine. So, gina-abbreviate siya as 5-HT. Okay? Now, ang serotonin can be a hormone and it can also be a neurotransmitter. Daghan kay effect si serotonin in the body class and you will see later nga daghan pud kaayo siya ug receptors. Pildig yun ang norepinephrine ug epinephrine ani sa kadaghan sa iyahang receptor. So daghan kay siyang effect in the body and one of that is serotonin is actually a potent vasoconstrictor. It is released by the clot. Kung magkaroon gud og blood clot, example nasamad ka, nagclot imuhang dugo, the clot will actually release the serotonin to constrict the blood vessel and allow for more clot formation. So, isa na siya sa trabaho ni serotonin. Now, we have another one, the interamine. It's almost similar to serotonin, but this time, this is a smooth muscle stimulant, especially in the stomach. So, it can increase the peristalsis. It can increase the motility of the gastrointestinal tract. Now, both of them are metabolites of the 5-hydroxytryptophan. Therefore, class kung this one is a board exam question, histamine is coming from the amino acid histidine, while serotonin and interamine comes from tryptophan. So, both of them comes from amino acid. So, silang duha, hydroxytryptophan for serotonin and Now, again, serotonin is our happy hormone, but it can also be a neurotransmitter. Pwede po siya local mediator, especially in the gut. If it is released in the gastrointestinal tract, naapod mismo sa GIT ang iyahang receptor. So, pwede po siya local mediator. And na-mention ako kagaina, it is an important part of the clotting process para mag-clot ang dugo nato during injury. And at the same time, histamine has its important role in migraine headache. Thus, ang mga tambal nato for migraine involves the serotonin also, the serotonin receptors. And aside from that, it is also involved in the signs and symptoms of the carcinoid syndrome. This is a condition wherein there is the formation of a tumor neoplasm sa enterochromaffin cells in the stomach. So daghan kaayog trabaho si serotonin class. But nevertheless, we call it our happy hormone. It is coming from tryptophan, and then pag naanatay amino acid na tryptophan, it can be released in the brain as i-process siya sa brain, and then nahimo siya og serotonin. And then mo na siya happy hormone nato. So kung mga ang pagkaon gani is rich in tryptophan, most likely mo na mga pagkaon that can also increase our mood. Ano po dato ang mood? Kay happy hormone man siya. Sa mga example sa pagkaon nga rich in tryptophan. Anyone? Pero kaya lang basta gabi man good, this will become melatonin. So may tendency ka na lami po di muhang tulog ini gabi. So example class sa rich in tryptophan, ang saging, the banana actually is rich in tryptophan. So pag sa morning nimo na siya kaunon, it can boost your mood also. Kaya mahimo man na siya serotonin. Pero pag sa gabi class, like the milk is also rich in tryptophan, but at night serotonin will become melatonin. That's the hormone of darkness, right? Para sa makatulog ka. Okay? Okay, very good. The cheese can also boost your mood due to the formation of serotonin. So again, basic pharmacology of our 5-HT. This is coming from the amino acid tryptophan, L-tryptophan. Ano na siya? The amino acid tryptophan has the indole ring, and then i-hydroxylate ang indole ring, tapos i-decarboxylate pagyod. So there are process involved until mahimo siya og serotonin. Mahappy ka magkahon cheese sa mukha. But in the pineal gland class, again, in the pineal gland, especially at night, serotonin will become a precursor of the melatonin, a melanocyte stimulating hormone. Melatonin, remember, is the hormone of darkness, and it is involved in the sleeping pattern or our circadian rhythm. Okay? Sa mukha. Okay. Now, stored serotonin can be depleted by reserpine. So, kung muinom ta og reserpine class, ma-deplete ang stored serotonin nato in the body. It can be displaced also. So, magawas ang serotonin from the storage vesicle. And aside from that, if ma-displace na siya, serotonin can be degraded, can be destroyed by MAO. So, di ba ang MAO is na-encounter nato na siya sa atong mga catecholamines, norepinephrine, epinephrine, and dopamine na inside the body, i-degrade na nila ng mga catecholamines. So, dili na sila makatake og action. So, appeal din ha si serotonin class nga kaya i-degrade ni monoamine oxidase. And mao ni akong ginaingon class ang daghan kaayo nga receptors ni serotonin. Sa kadaghan nagalibog ko sa ila. Nagalibog ko sa ila. Mao nang yang only receptors na I cannot really remember until now. Sa kadaghan nila. numbers ni siya ni siya silang tanan nag-start na siya sa 5-HT referring to serotonin. So serotonin receptors sila, and then followed by a subscript na Roman numerals, numbers, and then followed by a letter for the specific type of receptor. So good ta sa 5H1, and then gikan sa 5H1 tama na siya A, B, D, E, F, P. And then we also have 5H2, 2A, 2B, 2C, napod tayo 5H3, 5H4, and 5H. By the way, ihimuan ninyo ni siya og subscript ha. Wala lang ako na siya na subscript din ha. 5HT, 5A and B. And lastly, we have 5HT, 6 and 7. Okay, nag-skip sa P. Ambot sila nga nag-skip na sa P. Now, kana na mga receptors, makita na sila all over the body pero naa sila major location. For example, the 5HT1A are seen in the brain, especially in the raphenuclei and the hippocampus. The 5HT1B actually ang hangtod F sa brain na sila tanan makita. Can be in the substantia nigra, the basal ganglia, the cortex, the putamen, or the hippocampus. Again, sa brain sila tanan makita. And then we have there the agonist and the antagonist. For the 5HT1B and 1D, we have there the triptans. Not just the sumatriptan but the triptans. Tanan klaseng triptans. Agonist sila so they can activate the 5HT1B and 1D receptors. Now, para asa gani ginahatag atong mga triptans, do not forget, na-mention ko na siya last time, they are drugs for migraine. Because again, serotonin is an important part in, na siya role in migraine headache. We have to activate the 1B and the 1D receptors for us to treat the migraine headache. And then again, the name of the drugs end with triptan. Sumatriptan. Daghan to tong last time, if you can review our lessons sa anti-inflam, antipyretic, and analgesic, na include na ko na dito. And then for 5-HT1P, this is found in the stomach, enteric nervous system. We have an antagonist there, the renzapride, though I will discuss them one by one later sa katong mga dili familiar pa sa inyo ha. Ang sumatriptan dili na ko mag lesson na kung maagihan man, agihan lang nato kadali, i-review lang nato kadali. And then we have for platelets, smooth muscle, and cerebral cortex, 5-HT2A, we have an antagonist there called ketanserin. And then we have the 5-HT3, we have sensory and enteric nerves, mostly in the stomach. We have antagonists here that end with cetron, granisetron, ondansetron, tropisetron, and they are all given as anti-emetic. Again, they are all anti-emetic, especially for our cancer patients undergoing chemotherapy. Kasi di ba, one adverse effect of the chemotherapy is kanang nausea and vomiting. Magsigig suka, di ba, ang patient after chemotherapy. So, pwede na to gamiton ng mga cetron, granisetron, ondansetron, and tropisetron. Antagonist na sila sa 5-HT3 receptor and anti-emetic sila. Now, for 5-HT4, we have CNS neurons and smooth muscle. We have the metoclopramide there. I don't know if you are familiar with metoclopramide. The brand name in the market is Plasil. Ayan, that's the brand name in the market, the Plasil. This is also an anti-emetic. So just like the cetrons, metoclopramide is also an anti-emetic, but this is an agonist in a different na receptor. Sa 5-HT4 siya. So kung mag-work mo sa hospital or you will have internship in the hospital, you will always encounter this. Metoclopramide kay mo ni ang pinaka-ginagamit na anti-emetic. So kanang mga magsigig suka, ginahatagan og metoclopramide. We have oral and IV na dosage form for this. So again, sa 5-HT4 na siya. Now let's talk about the tissue and organ effects of our serotonin. For the nervous system, serotonin acts as a neurotransmitter. And then I have mentioned a while ago that especially at night in the pineal gland, serotonin will be transformed into melatonin, the hormone of darkness that is involved in our sleeping pattern and circadian rhythm. Now, the 5-H3, take note, the 5-H3 receptors in the gastrointestinal tract and the vomiting center nato sa brain in the medulla. So, natay vomiting center sa brain class in the medulla na involved siya in the vomiting reflex kanang para magsuka gud ka. So especially for example, the chemotherapy drugs sa mga cancer patients nato can actually affect that receptor in the brain mo na after kay magsigig suka ang patient. That is why gina-antagonize nato sila. Okay, again, the chemotherapy drugs can activate the 5-H3 receptors in the brain and also in the gastrointestinal tract, leading to vomiting. So ato siyang i-antagonize with the granisetron, ondansetron, or the tropisetron. Again, para dili magsigig suka ang patient. Now, the serotonin also, aside from those things na na-mention nako, is a potent stimulant sa pain and itching sa atuang mga sensory nerve endings. And they are involved for the signs and symptoms na caused by bites or mga stings from the insect and the plant. Kanang matrigger bitaw ka, sample paakon ka o one type of an insect, and then since na-injury din matrigger pud ang pag-release ni serotonin, and it can also trigger the pain and the itching dito sa gipaak sa insect na. So appeal siya for that thing. Daghan kay trabaho ang atuang serotonin. Now, going back to the 5-H3 receptor in afferent vagal nerve endings, this is also, aside from the emesis aside sa vomiting, this is also associated with the chemoreceptor reflex called Basel-Jarich reflex, na kapag ka matrigger na siya class nga part sa atuang lawas, matrigger ang receptor, it will cause marked bradycardia and hypotension. So, maka-cause siya og lowering of the blood pressure and lowering of the heart rate, pero it has nothing to do with the beta receptors, the alpha receptors. Lahi pod, serotonin receptor associated with a reflex involved in this effects, bradycardia and hypotension. So muna tanan ang mga effect ni serotonin in the nervous system. Muna dili nato ma-generalize kay tungod daghan kaayo siya og receptors. Now how about the respiratory system? The most important receptor for the respiratory system is the 5-HT2A. But ang iyahang effect is not that significant. It just has a small direct stimulant effect sa bronchiolar smooth muscle. Kung ma-stimulate ang atong bronchioles, it will cause contraction and it may cause bronchoconstriction. Okay? Now, how about sa cardiovascular system? Sa cardiovascular system naman, it may, sa 5-H2, specific for the 5-H2 receptor, it can cause also contraction of the blood vessels. So it can also cause constriction. And aside from that, na-mention na to kagaina, that serotonin is involved in the clotting process, and the receptor there na responsible is the 5-H2 receptor. So sa clotting process na and sa blood vessel. Kanya-kanya sila receptor The nervous system, most of the time, the 5-HT3. Respiratory system, specific 5-HT2A. For cardiovascular systems, mga 5H2 receptors, 5H2, 2A, 2B, 2C, appeal na sila diha tanan, basta 5H2. The same thing with the gastrointestinal tract. We also have the 5HT2 receptor here na if stimulated, it will cause stimulation of the gastrointestinal tract, increasing the movement or the motility, or that is what we call the peristalsis. Now, how about for the skeletal muscle? It's still the 5HT2 receptors, 2A, 2B, and 2C that are present in the skeletal muscle. When in fact, if you have excessive serotonin in the body, it may cause serotonin syndrome, which is associated with the skeletal muscle contraction. There is excessive muscular contraction here, class, for the serotonin syndrome because ang ma-stimulate na receptor ang 5HT2 na naa sa skeletal muscle. So, kanusan ni siya ma-experience sa patient ang serotonin syndrome? Take note of this, drug-to-drug interaction. Pwede siya mahitabo sa patient if mag-take siya MAO inhibitor. Again, mag-take siya MAO inhibitor. Remember si MAO? MAO is. Diba si MAO is used to degrade the serotonin. Kunya kung ato ang i-inhibit si MAO, mudaghan class ang serotonin in the body. Now, naatay mga antidepressant, diba, na MAO inhibitors. Now, kung gidugangan pag yun siya og SSRI, unsa gani ng SSRI, selective serotonin reuptake inhibitor. These are also antidepressants. Please review our lesson sa mga antidepressants nato. Selective serotonin reuptake inhibitor para dili mag-reuptake kung cell pa ni nakagawas na si serotonin, to inhibit the reuptake para ibalik siya sa sulod sa cell, inhibit nato using this drug. So ang effect ana niya, mutaas pud ang imuhang serotonin. Mga antidepressant ni sila, remember our serotonin is our happy hormone. Kung isabay na silang duha class, you will have excessive serotonin in the body that may lead to serotonin syndrome. Again, causing excessive muscular contractions. The patient may have seizure. Dili na, grabe na, manggahi na yung patient ani sa excessive na muscular contraction. So that is the reason why, class, hindi natin pinagsasabay yung ating mga antidepressants. Kung for example, nagamit ang patient og MAO inhibitor and then nakita sa psychiatrist na wala na kaayo nag-effect ang MAO inhibitor sa ato ang depressed na patient, mag-shift na siya into SSRI, unsa ginahimo, kailangan og 2 weeks na pahuway. Meaning, stop ang MAO inhibitor and then before ka magsugod sa imuhang SSRI, kailangan og 2 weeks na interval so that the body can get rid of the drug first, the original drug first, the MAO inhibitor, before ka maghatag og another group of drug. Kay basin magdungan sila sa sulod, it will cause serotonin syndrome. So we will end here for this morning. We will continue with the clinical pharmacology of serotonin. Isa-isahon na nato atong mga drugs nga nagatake og action sa serotonin, whether they are antagonist or agonist, basta sa mga serotonin receptors. But for the meantime, any question?